we'll just start out, and then you were going to ask some questions maybe of those who wanted to stay. Okay. So we're going to identify ourselves in the hospital. Hi, my name is Maya, and I'm a student nursing assistant. I'm really pleased to work with you today. We would wash our hands and then explain that we need to measure their weight and their height. Now your scale has to be 0 first. This is the most exciting thing for me. The new LNA program is going to be so good for our community and our students. I'm very excited to be helping out with the program. Got 40 years of nursing experience, and it's time to pass it on to others. So I'm very, very happy about that. Got a great group of students. We're going to be going to the hospital for clinical and into the local nursing homes, a couple of them. We start that on Friday. It's very exciting. So I'm just really happy that the community has this for them, because it is said that in the next 5 years, there'll be at least 5,000 healthcare jobs available for us. Okay? So then you would help them down, make sure that they're stable, pull your bar up to do your height.
Step on facing out.
Again, we would make sure that they're stable. Okay?
Oh, sorry. I didn't know it.
Yeah, that's part of it.
I'm Sandy Merkel. I'm an RN instructor, clinical instructor for the class. I will be with the students at the Thompson House for their clinical time.
You would be 65 centimeters.
And I'm Heidi Fisher. I'm also an RN, and I'll be taking the students to the Med-Surg unit at the Brattleboro Memorial Hospital.
Right now we're getting to know the students. This is our first exposure to them, and trying to give them a little bit of information about what it will be like when they come to the facilities and work with actual residents and patients. This is an ongoing project that goes until May, the end of May. We'll have the students 2 days a week for 2 hours a day, so that they will get their clinical experience in to make them eligible to take the LNA exam for the state of Vermont.
It's part of, there are multiple pieces that are involved in the program. Part of it is classroom time, part of it is lab time, in the clinical lab time, and then we do the actual clinical time, at the facilities, local facilities. And all of those are required as part of the preparation to be able to take the exam to become an LNA. Assessing their performance in the clinical setting, not so much the classroom piece. That's Kathy Forrester's part of the picture. So I'm very excited to be part of that.
So am I.
I think it's great for students to start at the high school level, to get into nursing and start at the LNA level and work their way up. And it's great, they'll graduate from high school with a career ready to go, as long as they pass that LNA exam, but they will.
My name's Amity Stockwell. I'm an 11th grader, and I chose to take the LNA class for after school. I'd like to go on to be an RN specialized in orthopedics, and this class would be very good to have after high school if I want to go on to be an RN. Right now my plan is to go to CCV to get my prerequisites, and then probably UMass to just do like my RN training, and that's going to be like where the main expense is. But I think that it would also be a really good opportunity to do an in-state school for prerequisites, and then maybe like travel to out of state, like a bigger school with like more like different clinical, because like in the same area it might be like a lot of the same clinical stuff. And I think that going like maybe down south, I wanted to go to like Louisiana or Mississippi, I might end up doing my main training there, so clinical might be different and it'd be a good experience.